Ontario reported another 548 new cases of COVID-19 in the last 24 hours. That's well below its daily record reached last week, and has Premier Doug Ford encouraged, he says, that the province is flattening the curve. Our city's on the front lines of this crisis, though, as optimistic. To find out, we've reached Ottawa's Mayor Jim Watson. Hi, Mayor Watson. Good to see you as always.
Thanks, Vashi. Glad to be on your show again.
Mayor, I'm sure like the rest of us, you're tuned into those daily provincial updates, and we keep hearing of the various hotspots throughout the province, and Ottawa is continually named as one. How concerned are you about the spread of COVID-19 right now in Ottawa?
Well, I still remain concerned, but you have to put in perspective, the three hotspots are the three largest population areas of the city, of the province. So you'd expect that, Peel Region, the City of Toronto, and ourselves. But we're not resting on that. We want to bring that number down. We had 62 cases confirmed yesterday, and we want to continue to push that number down because obviously we want our residents to be healthy and safe in their community. And we want to see the end of some of these restrictions. And the only way we're going to do that is if we continue to follow the advice of our medical officer of health. We have a great one here, Dr. Vera Etches. She's doing remarkable work with a good team around her, and we continue to work very cooperatively with the Prime Minister and the federal government and the province and the Premier. And spoke with the Prime Minister yesterday, and he asked us, what more they can do. And I have a call with the Premier later today. So, it's all three levels of government working in collaboration because, we park the partisanship at the door to get the job done.
Okay, I want to ask you about both those calls, but first I have a question for you, kind of jumping off what we've heard, for example, from Mayor Tory in Toronto, which is kind of a request of the province to go further on the restrictions, especially where, for example, restaurants and bars are concerned. Are you going to advocate for that to the Premier, or are you satisfied with the current level of restrictions?
No, I'm satisfied with the current level of restrictions. If we see any problems in a particular restaurant or bar, for instance, our bylaw officers will go in, and we've stopped the issuing of warnings now. We're tired of being the nice guy in warnings, and we're giving out tickets. I think there were 10 or 11 given out in the last couple of days, upwards of $800, and that stings, obviously, to an individual or a restaurant or bar owner. But we don't believe that that's necessary, certainly in the City of Ottawa at this point. The vast majority of the restaurants and bars are following the rules. They're limiting the number of people at a table to 6, which is the new provincial rule. And they're also keeping physical distance between the tables, and the waiters and waitresses and bartenders are wearing masks. Where they're not, obviously bylaw steps in and fines them. And as I said, an $800 ticket is a pretty big kick in the pants for someone, and they'll not do it again, I'm sure.
Does the data show you that transmission is not occurring to the same, where is, I guess, transmission occurring? Where is the problem? Is it weddings, as, for example, the Mayor of Brampton has told us in that jurisdiction? Is it get-togethers in houses, as it is in Mississauga, as the Mayor there has told? What is the issue here in Ottawa, do you think?
Yeah, it's primarily at private residences. Obviously, the long-term care homes still have a large number of outbreaks or individual cases, but there's no question it's private residences, events at banquet halls and so on, where there's more people that should be there, number one, and they're not practicing physical distancing if they do adhere to the number of people that they're allowed. We had it, for instance, we had to issue a ticket. There was a house, an Airbnb property, 60 people. Well, the police and bylaw came, people were running out the back door to try to get their numbers down to 10 because that's all the number you're allowed to have. But they were still given a ticket, and Airbnb was notified, and that property, I hope, is now off the list. So those kinds of things are not helpful when you have people coming from all over the country into a party. I don't know what kind of a party it was at this Airbnb, but we got neighbors' complaints. We moved quickly on it, and they were fined.
I'm sure you've heard as much as we have from parents and people who have been in those testing lineups. I know that the province has changed some of the rules, and so now you go by appointment, but that still means there's a big backlog. What's your ask of the province and the federal government, or did you have an ask of each of them where testing is concerned?
Well, we have an option that's been put forward for us. We're fortunate in Ottawa because there's a lot of federal labs and a lot of federal buildings that can be used for testing. So Minister Hajdu has offered to find a site for us, and the federal government would pay for it in the south end of our city. I'm speaking with her, I believe, on Thursday, and hopefully we'll be able to announce something on that front to help the residents in the south end. The appointment system was something we pushed in correspondence with Premier Ford, and I'm glad that he He accepted the recommendation to have an appointment system, because as we get into the cold weather, having people with their children standing outside an arena for 4 or 5 or 6 hours is just inhumane and very inefficient use of everyone's time and resources. So, we have been pushing for additional testing capacity, and we also need additional laboratory capacity, because people are not getting their test results in some instances 4, 5, or 6 days, and that's just not acceptable. So the fact that we've gone to an appointment system is making it more efficient, more humane. You don't have the lineups anymore. More pharmacies now have the testing capacity, but there's no question. I think the hospitals in the province are playing catch up because school came back in September. We all knew that, and we should have probably had greater capacity at that time to treat people we knew that were going to come out of the school system, because you put 100,000 plus students back into the school system, and there's going to be some cases of COVID-19 for sure. So
is that a big part of your discussion with the Premier? Like, what's your central ask of the province right now?
Well, it's to continue supporting the funding for additional test sites. We need one in the east end of the city. The city's retrofitted an arena, so the Mulford Hospital hopefully will be ready by mid this month to test people in the east end. The federal government has offered some space in the south end, and we hope to get that up and running within the next couple of weeks. And then we need a downtown location for those people, particularly that don't have a vehicle and can't go to their drive-through center that's located near our baseball stadium. So it is all hands on deck. It's frustrating, I know, for people who are waiting for results or waiting to get tested. As you know, the hospitals in the province run that. We're trying to be a good partner in getting some of the logistics and providing our facilities free of charge, so that we can get more people tested and more people treated if they come out with a positive test.
Okay, Mayor, I'll leave it there. Thanks for your time, as always.
My pleasure. Thank you.
This weekend is Thanksgiving, usually a time for big family gatherings, but with the second wave of the pandemic bearing down on many provinces, Canadians are looking to the provincial governments for guidance on how to mark the occasion safely. In Ontario, Premier Doug Ford is being accused of sending a confusing message to residents. Here he is trying to clear that up today.
Play it back. I said stick within your household. Stick within 10 people.
For more on all of this and Ontario's COVID-19 resurgence, I'm joined by Dr. Eric Hoskins. He's a public health specialist and, of course, former Ontario Health Minister. He's with us from Toronto. Hi, Dr. Hoskins. Good to see you.
Hi, yeah, nice to see you, Vassie.
I have sort of some general questions about the trajectory of the virus in Ontario, but let me just pick up on that thread on Thanksgiving. What's your best advice to people in Ontario right now, based on what you're seeing around the epidemiology of the virus?
Well, I mean, I think the advice from the Premier, the second piece of advice, and the advice coming from our public health officials is a good recommendation. I think that, given where we are in the pandemic and with the increase in cases that we've seen over the last few weeks, it's a very sensible approach and a good recommendation for people to stick to those within their own household. Once you get beyond your own household, you're putting, even if that risk is a small risk, you're putting others at risk. So at this particular time, because frankly, we're beginning to see the tiniest of positive data coming out to suggest that Ontarians are getting a handle on this latest upsurge. So we can't let our guard down, and it's an important measure, I think, for all of us to try and keep those social circles as small as possible.
As soon as you said the tiniest bit of positive news, that's exactly what I did want to ask you about, because there was some conversation today at that briefing around, or the press conference around, that the numbers are not great, obviously, but not what they were, let's say, even last week when they were hitting those daily highs. What is your read on the number right now?
Well, we need to be cautious, right? Because the day-to-day numbers, they don't tell the full story. But today we had 548, which is below the 7-day moving average. I think is 612 is the average over the last 7 days on a daily basis. So as long as we can keep pushing it down and stay below the 7-day moving average, that's really important. We're starting to see some increases in hospitalizations, just under 200 people in hospitals right across Ontario. It's still about a fifth of what we saw during the worst of the pandemic back in April and May, or April, I suppose. And we're seeing about 1.3% of the tests coming back positive. We're seeing a reproduction rate, which is the ability of the virus to spread and to grow. We're seeing that just over 1%. So we're at a point, not unlike British Columbia, that Bonnie Henry today suggested that they were flattening the curve, that they had stabilized things. I think if we all, as a society, as communities here in Ontario, work really, really hard over the next couple of weeks, I think we can beat this. And I think we'll see the stabilization and we'll see, hopefully, a decline over the next couple of weeks.
It's an interesting comparison because that press conference that Dr. Henry gives, whenever it happens, it falls on our show's watch. So we've heard kind of the whole, go through the timeline with her. And I remember a month ago, I would say, she was up there saying things are bad right now and they could get worse. Like, we're at this very, very important juncture. So it is a bit encouraging to hear that things, after she said that, it looks like people in British Columbia really did pay heed and take that to heart.
Yeah, and we knew this would happen, right? We knew that as we reopened the economy and allowed people to socialize more than they did before in the late spring, early summer, we knew we would see an increase in cases. It was inevitable. But we now have the levers that we can use to contain that spread. And that's what we're seeing put into place in different jurisdictions across Canada. But also, rather optimistically, I suppose, but if you look at other places around the world, many of them are going through similar surges in cases. And when you look at them, they're also, after 2 or 3 or 4 weeks, those cases, the numbers of cases are stabilizing and they're declining again. So if we use the rest of the world as an example, I think we have reason to be optimistic. But I don't want to say it in a fashion that it's so critically important that everybody do their part. We need to continue to mask, physical distance, keep those social circles small. And again, going back to Thanksgiving, I think the next week, 2 weeks is so critically important. If you can reduce those social circles down to the people that are closest to you and you can trust and are low risk, then that, I think, is a real contribution to being able to stamp this out. You
mentioned the various levers available to us. And I wanted to get your take, just because you come, I think, from a unique perspective. You're familiar with the healthcare system. You're also familiar with what it's like to be a politician and have to make decisions that kind of weigh a myriad of factors. And that's something that the Premier has alluded to when he kind of keeps getting pressed on whether or not the province needs to go further in the restrictions that are in place. Yes, they have certainly changed the hours, for example, for bars and restaurants, the cutoff for serving alcohol, the number of people who could be in the restaurant or sit at a table, things of that nature. But Mayor Tory in Toronto is asking for it to go further. Mayor Watson said, I just interviewed him, he said it's okay where it is. What do you think, from your vantage point?
Well, it's a very tough question to answer. One size does not fit all here, and it really depends where you are in the province and in the country. I'm a public health expert and an epidemiologist as well, and so I've been working very closely on the issue of COVID since its inception. If I was to make a call today, I would say, and for Toronto or for those high impact areas, I would say today is not the time to further tighten the restrictions on restaurants and bars. I may have a completely different answer tomorrow or in a week's time, but I think what's most important is really to emphasize to all Ontarians the importance of physical distancing, masking, and especially keeping those social circles low. We know that a lot of the outbreaks are happening in private residences, and they're happening when large groups of people are congregating and not using PPE or physical distancing. That's what we need to get a handle on. And there are certain it's a social behavior. It's not the location as much. And so that message needs to get across to bars and restaurants as much as anybody, that they really need to enforce the rules, the recommendations, the laws that exist that require and mandate the physical distancing and the separation.
What is it about today that leads you to that conclusion? Because you were pretty specific, right? Today, you would say no.
Well, I think, it's, again, it's a balancing act, right? We need to understand that this was a deliberate thing that we did, reopening the economy. We did it for a specific reason because we know that people's health and well-being is dependent on them having financial security. And so whenever we're looking at a measure which will have a substantial negative impact on financial security, I think we need to weigh that against other measures that we might have in place. I think that, the announcement today on the rapid antigen test by the federal government for testing, that is a game changer. We need to flood the country at all levels with rapid tests and antigen tests, not just the public sector, the private sector, home tests, because that combination of testing, case follow-up, the contact tracing rather, as well as people, every single individual doing their part. Those are the most impactful measures that we can take. Again, it's safe to be in a bar or a restaurant as long as you're practicing those physical distancing and masking regulations, as long as you're following those rules. So it's really about further transparency as well. Like, I think every single bit of information that we have about this pandemic, short of revealing somebody's personal health information, but everything short of that needs to be provided to the public and to the experts so that together we can be as informed as possible and we truly will understand what our role is to minimize the spread.
I just have a few seconds, but you mentioned the testing and flooding, kind of flooding Canada with it. It sounds like a lot of that additional testing won't be available for a number of months. Is that a concern?
Well, it is a concern. So I was, calling for rapid testing way back in April, even before we got out of the lockdown, and ever since on a regular basis. It's I know Health Canada is working exceptionally hard to approve, and there needs to be a requirement that the tests be adequate. But also, like, there's a difference between a confirmatory test, like a PCR test, and a screening tool. And there are many effective screening tools out there. When people, I'll end on this, it's a little bit of a weird example, I suppose, but when people over 50 get their stool screened for occult blood, for hidden blood, as to detect cancer in their colon, that's only 70% effective. It only detects 7 out of every 10 cancers. But we don't say that test shouldn't happen because it gives people a false sense of security. So there are all these excellent rapid tests that are being used virtually everywhere else in the world that have a high enough level of sensitivity or accuracy that they're exceptionally useful as a screening tool. And imagine if everybody could have access to that through their pharmacy, to use at home or in the pharmacy, their family doctor, at the workplace, through the public system. I think that's really, really important as a measure to reduce the community transmission of this virus.
Okay, I'll leave it there. I did not expect we were heading to an example around stool samples, but thank you. Thanks, Dr. Hoskins. You made it clear. Yeah. Appreciate your time very much, Doctor.
Yours too. Thank you.
Dr. Eric Hoskins is, of course, a former Ontario Health Minister and a public health specialist. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.